Hello, friends. So today let's talk about the most important evidence for your portfolio pathway, that is case histories. Uh, this is kind of, a make or a break evidence. If this is good, if this is of highest quality, then the chances are that your your application will be approved. So we need to ensure that we are paying a lot of attention on this HLO, that is HLO2. Now, few key points to be mindful, and this is for all specialties in psychiatry. So whether it is old age, general adult, psychotherapy, and what are those points? Your case histories have to be very comprehensive. You have to show the journey to the evaluator right from the beginning till the end and demonstrate your role uh, as a consultant. So, what does that entail? You're seeing the patient, you're doing a comprehensive history of presenting complaints, then history of presenting complaints, and other elements of history. You're doing a thorough mental state examination, a thorough physical health examination. So, my suggestion would be that if you're doing physical health examination, do everything. In physical health examination, do the general examination, do systemic examination, even if it's a neuropsych case, make sure you're also checking. You're not only doing a detailed neurological examination, but you're also doing cardiovascular, respiratory, gastrointestinal. You're covering every aspect to it. Bear in mind, if you're doing a neurological examination, follow the entire process: consciousness, motor, sensory, reflexes, um, cerebellar functions, also cranial nerve examination, every cranial nerve. So again, make sure that it is very, very thorough. And then you're also including your risk assessment, your formulation, the 5 Ps. You are putting an initial treatment plan, then you are doing follow-up reviews, and then so when you're discharging the patient, you are summarizing the findings, and then in your discharge, you're also including the handover plan. So everything has to be very, very comprehensive. They want to test your skills in terms of how would you handle a case as a consultant psychiatrist. I will talk about it more in length when we talk about the HLOs, the specific elements of case histories in every specialty. But it has to be very comprehensive right from the beginning till the end in every setting. So if it is old age psychiatry, it has to be, you have to show that you're submitting cases from inpatient, you're submitting cases from the crisis team, from CMHT, and from memory assessment service, and preferably from hospital liaison setting as well. Now, your your first case, the first assessment you do for that particular case, that has to be detailed, of course. The follow-ups can be to the point that you're doing, you did so and so, the patient is feeling better, include some positive findings, and then put plan in place. Similarly with your subsequent follow-up reviews. But when you're doing the final review before discharge, that again has to be comprehensive, where you're including everything. Again, you don't have to include the pre-morbid personality or anything of that sort, but say in the first assessment, if there were some positive physical health findings, then that is something which you need to see whether there has been any improvement. Just to give you an example, if somebody comes to you with lithium toxicity, then towards the end of discharge, towards discharge, you have to ensure that you're checking the lithium levels or other parameters, the renal function and everything. So that has to be mentioned in your final summary before you discharge. So You have to follow the biopsychosocial model. You also have to include any safeguarding concerns, and everything has to be factored in. Reflection, very, very important. So, we learn every day, it's a lifelong learning process. So there would be times where you've dealt with a particular case, but when you look back at it, you feel that maybe you could have done something differently. So reflection gives you that opportunity. So you don't have to do a reflection of every cases. So say if you're doing cohort 2, so you have to do reflection of every 30 cases. If you want, you can do. Nice, very nice. But maybe you can pick a select few where you felt that these cases were really very challenging, and that reflection gives you an opportunity uh, to show to the evaluator that what you learned from the case. Um Sometimes when you're reviewing such complex cases, you would be reading some articles or you would have read some book. So that reflection would be an opportunity for you to mention that you read certain articles and the latest evidence, and based on that, you made that decision. Uh, you can also mention that, what is it that you could have done something different. So it's okay, you can mention that maybe I could have done that test, maybe I could have done, something else. Or maybe I could have referred the patients, to this particular specialty. Could be anything. So it's important that you mention about what exactly you learned from it, what were the positives, what is it that you could have done differently, and what were your learning points from that case. So having a good reflection will definitely help strengthening your case history, and that will also form part of your triangulation. So triangulating the evidence is very, very important in terms of reducing your workload as well. How do you ensure that you're using that one particular piece of evidence as a full package? So you've done a case, you feel very confident about the case, you add a reflection, and then you add a workplace-based assessment. You've discussed with your supervisor, and the supervisor has done a good workplace-based assessment for you. So you've triangulated that evidence. So again, the other example is, say you're working in an inpatient setting. You've done a thorough case history. You've also added a tribunal report. Along with the tribunal report, also you've also presented the case at the tribunal hearing. Always ensure that you are asking for the minutes of the tribunal hearing where your name would be mentioned during, when you're presenting the case. So that is how you triangulate your evidence. You had a case history where you've included your tribunal report, you've included the minutes there as well, and you can get a workplace-based assessment, or you can do a reflection. So this is how you triangulate your evidence. So make sure that that is also included in some of your case histories, and follow the guidelines. Stick to the guidelines. Stick to these specialty specific guidelines. Uh, if I reflect on my journey, when I submitted for the first time, I received a feedback, and I only had one recommendation, and that recommendation was to submit more cases, which includes detailed physical health assessments. When I was thinking about my evidence, at that point in time, I felt that I've captured that, in my case histories. But then when I reflected deep into it, and when I discussed the outcome with my supervisor, we felt that I submitted a lot of evidence, lots and lots, which were not even included in the guidelines. I added a lot of evidence. The aim was to create a good impression. But actually, what that did is, I feel that maybe the important bits uh, were hidden somewhere, because there was so much information about one case. One case, there were a lot of things included. So sometimes, the key bits can go missing. So it's very important that you stick to the guidelines, see what is required, The key requirement, as I mentioned, that it has to be comprehensive, where you have to clearly show in your case history where the history is, where the mental state examination is, where the physical health examination is, where the risk formulation is, where the initial management plan is, where the follow-up reviews are, where the referral to other specialties are, where the handover is at the time of discharge, where the safety plan is. These are the key aspects you have to mention. If they are asking for case histories, just make sure you're sticking to the guidelines.